For tonight's discussion on equity in healthcare. And this is the second time many of you have been with us and a lot of new faces as well. So we're looking forward to a wonderful evening with all of you. You are the reason we're here. We are looking forward to you, not just as an audience, but as full participants tonight. This is, as I said, the Akron Area Interfaith Council's second of 5 weekly get-togethers, examining the challenges and the track record of the Biden-Harris administration's first 100 days in office. That Biden and Harris are dealing with issues crucial to our nation and our community. But before we go down that road too far, we'd like to get the evening started by asking Tom Brody, the chaplain at Akron Children's Hospital, to start us with prayer.
Tom, you need to unmute. There you go. You're good.
Spirit of life, we come with prayer. We have been created as embodied creatures so that we may run and play, sing and dance, laugh and cry, love and give birth to the next generation, and do all the other myriad things that being alive allows. But our bodies are not perfect. These bodies of ours do break down. Whether the illness is brief or chronic, the accident heals quickly or not, the defect is present at birth or appears later, death comes quick or slow, we are indeed affected by illness in body, mind, and spirit. Healing requires turning for help to the community that surrounds us. And in fits and starts, we in the United States have created the largest support system in all of human history. Sadly, we have just not seen fit to make it available to all. Am I my brother or sister's keeper is not a question we answer yes to for all. We have not defined good health as a right for all. This evening, we take up this apparent dilemma. That is, how should we take care of all those who ail, regardless of their place in our community? May we listen closely both for justice and for concrete steps toward justice. And we pray for the wisdom for our leaders, both local and national, that a vision emerges from their debates to truly make us all well, body, mind, and spirit. Blessed be. Amen.
Amen. Thank you, Reverend Bodie, who is a member of the council committee that developed these forums. And quickly, I'd like the other members of the committee to wave hi to everybody. Kathy Ress, Connie Dubik, Alan Fortnoff, and Tiffany Thor. This series is the newest chapter in a long history of examination, dialogue, and action by the Interfaith Council. For more than 40 years, it's been bringing together a diverse community in the Akron area to respond to social, moral, ethical, and cultural issues. The issues highlighted over these 5 Tuesday evenings are immigration, healthcare access, racial justice, climate change, and economic justice. And we are recording these so we can share them in other formats as well. Tonight, we're digging deepest into healthcare, its accessibility and effectiveness, especially through the prism of COVID. Leading off our discussion is Dr. Kristen Kranz, who practices cradle-to-grave medicine in Medina and Cuyahoga counties. She's a graduate of the University of Cincinnati College of Medicine and has been practicing in Northeast Ohio for more than 2 decades. She and her veterinarian husband have 4 children, including an adult son, Sid, whose autism has helped inform her advocacy for health equity and justice. She also works with Spawn Ohio and Our Revolution Ohio. Our faith reflections on these issues come from Ivanka Hall, Executive Director of the Northeast Ohio Black Health Coalition, and Pauletta Hatchett, a minister at the House of the Lord. Ms. Hall, a proud graduate of Marshall High School in Cleveland, holds a master's in public administration from Texas Southern University. Following the murder of her mother in 1974, she is focused on social justice efforts ranging from food security to lead poisoning to a ban on methyl tobacco products. She's a mother, grandmother, Robert Wood Johnson Fellow, researcher, and philanthropist. For nearly 3 decades, the Reverend Hatchett has been serving at the House of the Lord, where her leadership roles include the Healing Ministry, Mission Ministry, School of Prophets, and Women's Ministry. She also has served on a prison ministry team and is an ordained interfaith chaplain who has spoken to more than 2 million people in 12 countries. Also, as I mentioned earlier, a key part of this evening are all of you. We welcome your thoughts, your questions, and other input, and ask that you use the chat function in Zoom to weigh in. Deb Klein of Cleveland Jobs with Justice has a bit more on how that all works.
Good evening, everyone. When we are ready for questions, we ask that you put your questions in the chat because everyone will stay muted, or you can raise your hand. And the way to raise your hand is not just by doing this. If you go down to the little circle, the smiley face that says reactions at the bottom right of your screen, there is a raise hand function there. They finally have added it over there instead of burying it where it used to be. So we ask that you please raise your hand or put your question in the chat.
Thanks, Deb. And now, Dr. Kranz, please begin our discussion and our understanding of a very complex issue.
Thank you so much. What a powerhouse of a team that we're here with today, and I appreciate being invited to speak with you today. It is a complicated issue, but we're going to try to simplify it down a little bit. And I will start with one of my favorite quotes: "Justice is what love looks like in public," and we can thank Reverend Cornell West for reminding us of this. Our faith and our values are integrally tied to how we treat each other. And the more I have delved into politics, the more I have found that I can simplify the needs, the demands, the values that matter: love, respect, equity. No qualifications should be needed. It's our humanity that affords us these rights. Raised Catholic, service to others is embedded in me as a life mandate, and it's certainly where my screen just disappeared. Sorry, this always happens to me. Hold on, people. I apologize. I let one of my kids play with the computers. Anyway, I'm having a problem here. My apologies. There's a strange page. I found it. All right. So no qualification should be needed. So raised Catholic, service to others is embedded in me as a life mandate. And it's certainly what has led me to a career as a full range family physician. In my almost 30 years of practice, combined with raising 4 children and one who's on the autism spectrum, it's that has awakened me to firmly believe that healthcare is a right. So I've been asked today to examine the new national policy initiatives by the Biden administration related to healthcare access and to review how this is a change from the previous administration. This I will do, but I'd like to expand on that and address how I view the government's role regarding health and healthcare to its citizens. Promises made. I think there are many promises made to us by our Constitution that are consistently broken. The main policy issue that I plan to focus on is access to health care. However, this can be broken down into a myriad of facets, including health care as a basic human right, the problem of tethering health care to employment, social determinants of health as unsolved problems, and systemic racism as an ongoing healthcare crisis. COVID-19 has laid bare these issues that have been long-standing in our country, and it's made obvious the truth that we are all dependent on the health and well-being of others. Sadly, our nation is failing us, and it has for a long time. The response, reaction, and results of COVID-19 are pitiful, and in my mind, immoral. The status of our healthcare system, in truth, I think is the same: pitiful. It's important to note that the system is not broken. It is doing what it intends. It makes profits for the CEOs and shareholders of insurance and pharmaceutical companies. We will never fix the system until profit and greed are rooted out. We will never fix the system until profit and greed are rooted out. National Nurses United is a powerful Union of Nurses, and they share that United Health Group has had its most profitable quarter of all time last year. And the CEO giants of various companies have made $79 million and $59 million. Cigna's profits skyrocketed 66% during the worst year of the pandemic. So let's pause and focus briefly on what the Biden administration has promised and has done so far. So Joe Biden ran on expanding healthcare coverage by allowing Americans to opt in to a Medicare-like plan. There's current talk, but no promise of a public option. There's promise for lower cost for most Americans, particularly around prescription drugs. The pandemic has also highlighted weaknesses in the U.S. healthcare system, with millions of people losing their jobs and their employer-sponsored insurance as the virus spread around the country. In order to address this, the Biden administration has opened a special Affordable Care Act enrollment period. And as part of the COVID relief package, Congress also has made millions more eligible for some of the premium subsidies to buy the plans. President Biden has also signed a series of healthcare-related directives that he has described as reversing the damage done by the former president. He has restored the Affordable Care Act and Medicaid to the way it was before the previous administration was in action, so that it now is more accessible, less expensive, and easier to qualify. I'd like to also comment on the vaccine rollout that on some levels has been impressive, but has it really been enough? And I will note that President Biden has made all adults eligible for the vaccine as of April 19th. So there is more that can be done to educate the masses about the need for universal vaccination. So we still have a ways to go. And we also have to acknowledge that the global community must be fully vaccinated, and the US must not hoard vaccine supplies. Vaccine equity is a pressing issue, and the US cannot pretend that self-isolation will solve the pandemic that is truly global. So I'm sure that a policy wonk could talk for hours about where we've been, where we are now, and where we're going. But I'd like to boil it down and simplify it. So Jesus said, love thy neighbor, and he did not qualify it. He didn't say, if they mow their lawn properly or if they don't put up certain signs. There's no qualifications to some of the rules that we've been given to follow. And that's how I look at healthcare. So I think that it's good that we see better access and it's improved, but it's woefully not enough. We really must have universal, full healthcare coverage for all now more than ever before. So Medicare for All Act was recently reintroduced into Congress, and it had a record of 112 original co-sponsors, and that number is climbing. So I'd like to pause and ask the question, what is our government responsible for? What are the promises made? And so, why look at the Constitution for this answer? And part of the core purpose of government, as explicitly stated in the Constitution, is to establish justice, promote the general welfare, and secure the blessings of liberty. We can never be truly free if we don't have our rights guaranteed. And our government must work to protect our rights. There really cannot be democracy nor freedom without safety and security, and this includes economic security with a living wage and health care and certain other things. This was defined by FDR when he created the Economic Bill of Rights. And he said in his second Bill of Rights that every American should have the right to a job, an adequate wage and decent living, a decent home, medical care, economic protection during sickness, accident, old age, or unemployment, and a good education. So I'm here today, and I've started to work politically because I believe that we should love and care for each other. I believe that we must all fight for our rights. Intersectionality is the crux of our struggles. All issues of social justice are intersectional. You cannot separate the fights for racial justice, economic justice, criminal justice, environmental justice, gender equality. They're all intertwined. In the same way, we must realize that all our struggles as people are intertwined. In a family, if one struggles, we all struggle. If one succeeds, we all succeed. And we must extrapolate this to our communities. and to our nation and to our world. Until we have our basic rights satisfied, we will never achieve success as a nation or as a world. And success must be measured not by dollar or growth, but by satisfying the basic needs of all. Basic needs that are not earned, but simply deserved because of a person's humanity. When one rises, we all rise. When one falls, we all fall. We are all in this together. So let's talk about why we need Medicare for all. So some statistics from National Nurses United. During COVID, 27 million people were estimated to be kicked off their employee-sponsored health care when they most needed to see a doctor. Prior to COVID, 29 million people were already uninsured, and it's estimated that 41 million were underinsured. Prior to COVID, there was a study from the Harvard School of Medicine that per year, there were 45,000 deaths due to lack of health insurance. And it's estimated that over 130 people die every day because they can't get the care that they need. Every day, millions of hardworking people are forced to choose between paying for health care and feeding their children. Healthcare and insurance costs and pharmaceutical costs continue to rise with no end in sight. And medical costs are the leading cause of bankruptcy, with 40% of Americans saying that they can't afford a surprise $400 bill. There are also rising numbers of deaths of despair, driven by healthcare costs and lack of access to care. This has only worsened due to the mental health stressors of isolation during the pandemic. COVID-19 has also shown a light on the health effects of systemic racism. Black, Latinx, and Indigenous people are 3 times as likely to contract COVID-19 and twice as likely to die. There are lots of statistics that will show you the difference between white and Black folks with the health disparities. I have an article that I'll share if somebody wants to see a lot of the numbers that are there. And I'll post that later in the chat. So there was also a study, the Health Policy Institute of Ohio released a policy brief on the state of Ohio, which shows a more than 30-year difference in life expectancy between the healthiest communities in Ohio and those with the poorest health. They found that those with lower incomes, African Americans, people with disabilities, people without high school degrees are among those who are the hardest hit by health-related disparities. And they concluded that not all Ohioans have the same opportunity to live a healthy life based on geography, race, ethnicity, income, education, or other demographic factors. We in medicine call this the social determinants of health, and they are truly far more important than your cholesterol level. Health justice is more than just the cost of a doctor's visit, the tests, and the drugs. Health justice is housing, transportation, education, a living wage, and more. So healthcare in America is in crisis on many levels, and I think that access is a joke. Even those with insurance are hamstrung by deductibles, copays, and fear of cost. COVID has revealed the insanity of tethering healthcare to employment. COVID has revealed that our health and our lives are truly intertwined, and we rise and fall together with each other's ability to comply with the mitigation efforts, and many simply cannot follow the regulations. We are the only industrialized nation where people go bankrupt over healthcare. We are the only industrialized nation where people use GoFundMe to pay for their chemotherapy. I've been practicing full-range family medicine for almost 30 years, and during my workday, I spend a huge percentage of my time discussing cost and helping patients and their families understand the necessity of medications, tests, and procedures. And it's often the dollar or lack of dollars that wins the argument. And you have to remember, I deal with people who have insurance, and there are many who have none. We all have stories, personal stories, and many of them are tragedies. For me, I remember the 40-year-old mother who showed up delayed due to fear of the copays and the cost of tests. And by the time she showed up, her breast was hard and triple its normal size. She was diagnosed with stage 4 breast cancer. Then there was my patient, Miss B, who had no insurance, elderly, bad lungs. We gave her samples every time she came in. She was gregarious and lonely, and she found me on social media, and I couldn't say no. So she shared pictures of her grandson and of the things she knew would make me happy. Well, she caught COVID-19, March of 2019. And after 2 hospitalizations, she was intubated. She actually texted me, "I'm afraid I won't wake up." And sadly, she did not. She died alone in the ICU, and I cannot imagine the bills that were incurred. Every physician has stories, many stories, of those who delay or don't show up, and COVID has caused many to lose their jobs and their health insurance. I would love it if everybody would turn their cameras on just briefly and share the raising of the hands as I ask just a couple poignant questions. So please turn your cameras on. And I think it's very important that we share our stories and make each other understand that we are not alone in this. So raise your hand if you aren't willing, that's totally fine, but just process this. Raise your hand if you don't have health insurance. Raise your hand if you have a pre-existing condition. Raise your hand if you don't have dental insurance or if you don't have vision insurance. Raise your hand if you worry about premiums, deductibles, and copays. Raise your hand if you have not filled a prescription due to cost. Raise your hand if you've delayed going to the doctor because of concerns over cost. Raise your hand if you have not done a job or procedure because of cost. Raise your hand if you're about to turn 26 and you struggle over coverage. Raise if you have delayed retirement to keep your health care coverage. Raise your hand if you've chosen a job or stayed in a job because of the need for health insurance. Raise your hand if you'd be doing something else, work-wise or career-wise, if you did not need health insurance. Raise your hand if you're in the arts and have to do something else in order to get health insurance. Raise your hand if you've only been offered a part-time job because small businesses can't afford to give you health benefits. Or if you are a small business owner and struggle over healthcare benefit costs. Raise your hand if you or someone you know frets or has anxiety over health costs. Raise your hand if you know someone who has gotten sick due to delaying care due to cost concerns. Raise your hand if you know somebody who has died due to delaying care or inadequate care due to no health insurance. Here's the most important one. Raise your hand if you think healthcare is a right. Raise your hand if you think your tax dollars should pay for babies, not bombs, healthcare, not helicopters. We should all want Medicare for all, which is full coverage for all healthcare for all living in the United States. So I've committed my life's work to taking care of all as if they're family. And as a mother of 4, including one on the autism spectrum, I understand that we're not all dealt the same hands at birth. And some of these differences are as simple as brown versus blue eyes, white versus brown skin, or different levels of intelligence. Some of these differences relate to your zip code or your parents' level of education, your inherited wealth or lack thereof. And while we must embrace and indeed respect our diversity, we must also support the deficits and deficiencies that others have. We must fight the inequality and injustices, many of which have been created by a racist system that is in our nation's DNA. No child deserves to be born into poverty. No child deserves a lesser education because of their zip code or color of their skin. No child deserves to get cancer or diabetes or any other illness. No matter our differences, we are united by one simple thing, our humanity. And as humans, we have certain inalienable rights, and I happen to believe that healthcare is one of them. So the current Medicare for All bill, I just want to briefly let you know, it's not the Medicare you might know. It is comprehensive benefits and freedom of choice, and the legislation will provide for comprehensive health care coverage, including primary care, hospital and outpatient services, prescription drugs, dental, vision, audiology, women's reproductive health, maternity, newborn care, long-term care services, prescription drugs, mental health, substance abuse treatment, labs, diagnostic services, and more. And people will have freedom to choose their doctors and their hospitals, and there will be no deductibles, and there will be no in or out of network. We will have no premiums or copays. And hopefully there will be no out-of-pocket costs. There will be other long-term services for people with disabilities and older Americans, and it will ultimately save money. Medicare for All will pay for the covered healthcare services, and it therefore has the power to eliminate the massive amount of waste that goes into the bureaucracy to get things done. Nearly all individuals and businesses would save on healthcare with no more copays, deductibles, and surprise bills. So it's very true that healthcare is a very complex issue, but I do believe we can simplify it by declaring the need for universal, full coverage, free healthcare for all living in this nation. Other nations do it, and so can we. There are many ways to get involved, and I'll post some links in the chat, including joining various groups, SPAN Ohio, which is Single Payer Action Network, National Nurses United, and Our Revolution Ohio. All of those groups are working locally and nationally to help us get coverage, full coverage. So I think just the reminder that I have to say is that it's our humanity that affords us our right to health care. And I appreciate the opportunity to chat with you tonight about it. And I'll be happy to answer questions later when we get to that.
Thank you very much, Dr. Kranz. Chaplain Paulette Hatchett, I'd ask you to, you were listening as we all were very intently. I'd ask you to reflect on what you heard from your faith and your community activist perspective.
Well, thank you. I really appreciate the powerful information that was shared. And from a faith perspective, I wanted to mention that as we come off of a real holy week and season of biblical feasts, I think of community and the price that I think of as a Christian, the price that Jesus paid for people's healing, for their freedom, for their wholeness, for access to be made for all. I think of the word unity. I say this because when we talk about health equity, equity relates to access. Equity relates to removing obstacles, barriers, boulders to healthcare and to all things. When we think of obstacles and equity, this means that as a community of people of different faith traditions, that we need to make sure that people are not feeling powerless, that they have the help and support that's needed to lift the boulders off out of their lives, that they have access to education, to freely express their faith traditions, that they have access to good jobs with fair pay, equal education, and that they have the ability to thrive in life in safe environments and with health care. As I mentioned this, I was thinking as I had been reading and thinking about historically some of the things that happened in many cultures over the years about captivity. We listen about wars and rumors of wars all the time. And we see right now, as we sit here, there are bombs going on all over this world and people are dying. And when that occurs, and many are taken as captive, many are put in and enslaved to other nations. When this happens, I was reminded of the days of Jeremiah, when the priests, the prophets, the merchants, all the business owners, the people who had influence in government, all went into captivity because of a disobedient nation, because people had left their God and had no more civility toward each other. We live in those days right now with uprising after uprising. In the midst of COVID and in the midst of death and a culture of Thanatos where we're dealing with the death force daily, we know as we pick up the news, as we look on the internet, we hear about death and war. What was done in those days was there was an exhortation to the people that even though you were in these difficult times of pestilence and war and division, that they were still to find ways to thrive, to have their children, and to seek the prosperity and peace of the cities. We're in that way right now in the midst of COVID. As I work in the area of health equity at a major hospital, the largest hospital in Northeast Ohio, daily we have chronic disease patients that come in. Daily we have mothers who are pregnant who come in and are unwed and are facing, because they live in a particular zip code, a high level of infant mortality. Daily do we have people that live in the cities and breathe unclean air and have lower, many decades of their lives taken off just because of where they live. When I see that, it's very difficult to the reality where the rubber meets the road. It's hard for those people to even grasp what is hope, what is life, and what is truth. When they live below the surface of the waters, I want to just remind us that when we see our brothers, we see people in our communities that need help, that need access to the good things in life, it is our moral and our ethical responsibility to love our neighbors as ourselves. It's not about what one person has, it's about the community. The prophet Jeremiah told the people to seek the welfare of the city and the welfare of the people in the city, because their welfare was bound up. Their own survival was bound up in the welfare of the city. So when we look at this, we must examine the condition of other people beyond ourselves, their educational, their economic, their political situation, their if they're burdened by taxes. We live in an increasingly smaller global world, global impact, but we must have local community that is available for people so that they can have access. And no longer can we walk around with blinded eyes, with ears that are deaf. We must open our eyes. The purpose of our eyes physically are to see, but spiritually to see the things that we need to see behind the scenes. And when we're able to do that, we get a new glimpse of reality. This is where vision and reality come together. Everything is not beautiful. People are longing for help. They are groaning under misery, and we must help them rebuild. We must help them build the walls of their lives and their personalities. We must allow them to have the living way and pull back the veil so that they can begin to live. People want to thrive, but they need others' help. I once read a powerful book by Ed Silvoso called Anointed for Business, and it talked about the poor are rich in faith, but the wealthy have access to resources and assets. Some kind of way, with all of the billions of dollars that have been made in a season where people are destitute and losing their homes, jobs, and lack health care. We must have a new moral compass in society, in this community. And it's amazing that we're coming together. We must recalibrate our vision, and we must recalibrate our compass of morality so that we care about those around us. Because when the calamity is happening to our neighbor, look out. It may be right around the corner in our own neighborhood. So as I leave this, I just want to say that today, many people do not have peace or access to services. They need healing of their minds, their bodies, and souls, which includes their emotions. People need healing. They need the Greek word sozo. They need to be healed, set free, and they need to be delivered. It will take all of us working together for that to happen. Without medical breakthroughs, hundreds and thousands of people who have suffered with COVID-19 would not have the physical healing and the medical care to survive. We are the wounded healers, and we must not be respecters of persons, regardless of race, ethnicity, gender identity, or religious tradition. We are all made in the image of God, and we all have a need for healing and wellness. I leave you with those thoughts as we reflect past days, days current, and the trajectory of where we are going.
Thank you very much, Chaplain Hatchett. Now we're asking for thoughts from Ivanka Hall. She's the Executive Director of the Northeast Ohio Black Health Coalition, and can, I hope, also reflect spiritually and what's going on in our community.
Hello, everybody. I hope you all can hear me okay.
Perfect.
So first off, I think it's important for me to tell you what my organization does before I jump into this. So the Northeast Ohio Black Health Coalition has been around since 2011. We have literally impacted the lives of hundreds of thousands of people over these last 9 years. Last year, during the beginning of COVID, on March the 16th, when they announced the closing of schools, we pivoted our services only because we wanted to find out what was going to happen to children who and their families who were disabled and not able to get to food sites. And so if the schools are closed and your child is normally getting a bus because they're disabled and the bus comes to pick them up and drop them off at the school, how would they get food? And so what we were met with was they have to get here the best way they can. And so for me, that was unacceptable. And so myself and my team created a program called Babies in Brunch. And between last May 16th, and December, we sent out 70,000 meals from my house. So we sent out 70,000 meals. And now, mind you, my income stopped when COVID started because usually I present across the country. And I'm not going anywhere until 2020 to 2024. And so because of that, it was okay, well, I'm going to be here. I'm not going anywhere. What can we do? And we started getting hundreds of volunteers that came out every day to take lunches and breakfast and lunches to the children. And then it went from that to weekly. And as the governor's mandates started changing, it went to once a month. So once a month, we would send out a 30-day supply of the healthiest food that we could get for our young people, things that they liked, things that were easy for their families to prepare. But the responses of looking at and seeing the expressions on their faces for some of the stops that we did, and then for us being able to do something that was unique. So giving out the food wasn't the unique part. That wasn't unique. The most unique thing that happened to me happened on Easter Sunday last year. So on Easter Sunday last year, that evening before, a drugstore called me and said, "We have an overflow of candy and we want you to come and pick it up." So I went to this drugstore that is 40 minutes from my house, thinking that they were going to give me a box of candy. And when I got there, they gave me a van of candy. We took the candy. Doctor, you didn't hear me talk about the candy. We took the candy and we put it in Easter baskets for all 100 children. I had all these baskets where I also run a catering business out of my house. And so I had all these baskets. I'm like, I'm not going to use them. And so we took the baskets, we filled the baskets with candy for each and every child, put books in them. And on Easter Sunday, I went from house to house taking those baskets to children. Many who had never had an Easter basket, who did not know God, who did not know the power of the gospel, and did not understand what it was um, to have people offer them Christ. So that is my Easter Sunday thing. But I think for me, the biggest part of my work actually is something that happened before Easter Sunday. Is when in John 2:13 through 16 is the Gospel of John, is when Jesus went into the temple and flipped over the tables and chased out the merchants and the people who were stealing from the community. For me, that is the most powerful thing that could happen, is to chase away the people who are stealing the very life force out of community. So the Northeast Ohio Black Health Coalition is a social justice organization that was created to to address the impact of racism on the African American community, disparities, including policy inequities, historical trauma, food insecurity, research, behavioral health and addiction, health promotion. And we do all of this by working to empower, educate, and advocate for underserved communities. A tough task. Um, and so for us, our issue has always been um, African Americans are plagued with persistent race based disparities that have existed for centuries. And this has impacted their health compared to their white counterparts and the population as a whole. And so, one of the things that I always do when I do presentations and when I talk to community is, talk to them about history. I'm a history buff. I have a degree in political science and history, and I have a master's degree in public administration with a focus on public policy. So for me, that whole historical piece, the context, because I think that a lot of times what happens is when we hear people talking about what's going on in the community, we don't understand the context of why the social determinants of health are so impactful in the African American community. And so the context is this whole theory about race and racism. So remember that originally race had nothing to do with how you looked. It was your language that you spoke. And so around the 1700s, so right in line with the enslavement of Africans, came this whole thing about race being about how you looked on the outside. So we went from the language that you spoke to how you looked. And there came the racism. If you did not look this way, then we were able to treat you this way. So the inhumanity of man was directly tied and linked to how we changed the definition of race. And so racism is a belief that a race is a fundamental determinant of human traits and capabilities, and that racial differences produce an inherent superiority of a particular race. And that's what we see so often today, is this whole thing around superiority. Who gets the crumbs? Who's at top, who's on top, who's on bottom, who is the forgotten few. And so when you talk about the African American experience, we have to understand also that African American experience between the African experience between 1619 and going into about 1965, into the right at the civil rights movement, that time represents 87% of the African American experience in America. 87%. So remember that. That's 87%. So after the civil rights movement, the time from 1965 to now represents about 13%, right? And so in the community as a whole, when we look at African Americans, what we're looking at is the result of the 87%. And so when we tell people to forget, you can get over racism, you can get over all of these things, we're asking them to forget about the 87%, and we cannot do that. And so as we're talking about COVID, and as you've seen in the news, this whole misnomer around the theory around historical experimentation and vaccine hesitation, two very distinct things that are going on in the community. One, this historical experimentation is about what has happened to marginalized communities in medical settings. The experimentation that took place for Black people and brown people all over the country, right? And so when we talk about vaccine hesitation, what they have to understand is the whole hesitancy has nothing to do with the historical experimentation, it has something to do with the results. Like, okay, well, we still didn't get better. And so a lot of people are thinking within our community is, okay, well, how do we know that we're going to get better? How do we know it's not going to be worse? And it's, well, because it's a vaccine that's made for everybody. And they're like, okay, well, if I take, okay, well, I don't think Pfizer is made for me, or I don't think Johnson and Johnson. I'm sure the doctor has heard the arguments about the various um, vaccines, because that's the whole thing now is, you know, people are doing this wait. And as soon as they see something happens in the news, like today with the Johnson and Johnson, they're like, see, that's what I told you. Don't do that. You know, and so we have to understand that whole thing. But we also have to understand the role of historical trauma, because in faith, when we're talking about, I have a minute. Okay. When we're talking about this historical, I was trying to say 10. I thought I only did 5, but okay. When we talk about this historical trauma, we have to understand that the African American experience in America around historical trauma, we've only had 2 times in our history that our health status has changed. One was during the Civil War Reconstruction with the Freedmen's Bureau, and the second time was with the Civil Rights Act. But in the last, since 2016, African Americans have lost 2.7 years of life expectancy. So now our life expectancy has dropped from 75 years to 72 years. And I don't know about anybody else, but I want my years back. And so the way to do that is to make sure that we are looking at policies and systems and how they impact people, and working within those systems and outside of those systems to force change, not punitive change, but to force change that will lift up the community from where they are. So for me, that is my piece, and I'm sorry, that is my time. And thank you all for having me.
Sorry, I'm still adapting to a little bit of being muted myself. But actually, we're going to move on to some topics that I have a feeling were in the rest of your prepared remarks. But before we get started with the questions, I want to make sure we're inviting everyone here to join us. Please put your questions into the chat and we'll get to them as quickly as we can. Lots to think about from lots of perspectives, of course. Ms. Hall, you did mention the developments with the J&J vaccine today, in which the FDA and the state of Ohio have put a pause on it. And given what you've talked about, and I also would really appreciate the thoughts of the other 2 of you, but given this history of both suspicion and lack of access, in particular with this vaccine or hesitancy, what can the community do to ensure this doesn't shut down the people who most need it from getting the vaccine?
Can I tackle some of that?
Absolutely.
So it is very challenging. And I think that the thing to remember is that the technology that we've had to create these vaccines has been there. So it's not that we're creating something brand new. The companies that, the scientists that are behind the vaccine knew how to make these vaccines and were able to rapidly put this into play. And so it's not like they just created something out of thin air. The technologies were there and they were able to tweak it to be there for the coronavirus. It's a very challenging time in that we don't have a lot of answers, and yet we know the results of what will happen if we don't get ourselves vaccinated. And the conversation is that we have 20% vaccinated right now in the United States, and we need 80% vaccinated to reach herd immunity. And yet there are other countries that have 0. And so those countries are going to keep bringing different variants in. So that kind of expounds, it's very complicated. What we used to say to people and what we were encouraged to tell people is the best vaccine is the one that's in your arm. So just go get it. And I have to tell you the amount of peace that I got when I finally got my vaccine. And I was the first one on the phone to get my husband and son signed up to get it. And the sheer fear that we had early on in this when we didn't have access to this. So it's very challenging, the mistrust of the systems. And I absolutely hear what Ivanka Hall talks about in terms of how do we convince people to do it and how do we win back trust. And even I used 2 years ago looked at what the CDC was doing, and I thought, well, I can't trust them anymore because of the changes that was happening within the government. So it is very challenging. So all I can encourage you to do is know where you get your information. There's a lot of malarkey out there, and right now, trust the science and trust the scientists. And I strongly encourage everyone to get the vaccines. I'll comment on the J&J vaccines, the same thing that happened in Moderna out in Europe, not Moderna. There was another one.
AstraZeneca.
Thank you so much. In Europe, and they had the same issue with the blood clots.
Yep.
They were able to break it down, and the conclusion was that it truly wasn't the vaccine. Now, I can't speak to that scientifically at this point. Yes, it makes all of us very nervous, but we certainly have seen the number of deaths that have occurred from COVID, and I think that the bottom line, the lesser of the choices is to encourage everyone, the better of the choices is to encourage everyone to get the vaccine. And they're going to pause the J&J so they can assess it and study it. And I wouldn't be surprised if we're back giving it again as soon as they've done the thorough assessment.
Chaplain Hatchett and Ms. Hall, is there anything you have to add about how in particular, when the trust doesn't exist, you can reach a community that needs it?
I was thinking about the statistics basically and how that relates to trust. For example, in Ohio, the percentage of people who are vaccinated with at least one shot is 34%. 20.8% of the people in Ohio have been fully vaccinated. So with their first and second shot, for example, or if it's a one-time as the Johnson & Johnson, they have that. But African Americans have made up 13% of our state's population in Ohio. However, only 5.6% have been vaccinated. Now, this is an example of disparity, differences, where the high need is, but there's been a low amount of number of people, percentage-wise, that have been vaccinated. A lot of this has happened because of the historical nature of experimentation and things that have happened over the decades and super centuries of time, with African Americans being used in experimentation for the sake of discovery and profit, and have their lives on the line. I wanted to mention that we can go with the speed of trust. We think about the concept of the speed of trust with the COVID vaccination. And I do know of many initiatives that are going on right now across the city to try to put new words in. Words are the things that create culture. And so the culture is trying to I'll say, invade the African American culture and the minority culture to have people trust.
I'd love
Yes.
I'd love to add to that, and I absolutely agree with everything you said. And I think that the mechanism for encouraging people is to build that trust by showing respect to the person in front of you, and to respect their fear and respect their concern. And I think, you can present data and information, but it's not that intellectual information that's going to change minds. It's going to be the stories and the needs. So I think that the question to ask too is, well, what do you and your family need in terms of the vaccine? How limited are you without it for your grandma and your newborn and your work? And what are the facets that the vaccine might give that person to help them understand their own story and how to empower that? And the hard thing is, when you have 20 minutes to do a full visit, as a physician, it's very hard to build that trust when you're given such limited time. So I'll just comment on that.
And there's a question that's on the chat too that asks about the impact of congregations. If you're having the pastor, the rabbi, the priest taking the vaccine and discussing that, yes, using people who are trustworthy models in the community will help break down the walls. But that takes time. And trust is based on relationships. And those have to be built and earned.
How about actually taking the vaccination right on a Sunday morning, right into the places of worship or Saturday evening? Can that work?
I wanted to mention that I attend the House of the Lord. I've been there for 27 years. We were involved in the COVID testing event, and we ran it on a Saturday and Sunday, and we got 1,500 people, including, that included our congregation. So those are some strategies that could potentially work. But again, people make their own decisions. We can only model.
There was a question early on about Medicare for all, and it kind of blends with a question that I also had, which is the question of, practically speaking, would the Obama administration be better invested in, would the Biden administration be better invested in massaging Obamacare and improving it? Would that have more of a chance, or is Medicare for all, is Obamacare so flawed that Medicare for all needs to replace it?
So that kind of comes to the question, some of the things I mentioned in my talk, and I think my goal is to shoot for the whole apple. We don't have time for middle ground. We don't have time for incremental steps and baby steps. People are dying. People are literally dying. So my favorite hashtag is live, survive, thrive. In the richest nation on earth, we should be doing all those things, and we're doing none of them. So in answer to your question, if we have to take small steps, we will, because we need to make improvement, but it's not good enough. And so love thy neighbor, Medicare for all. We need the whole thing. And I'm not going to settle, and the activists that I work with are not going to settle till we get there. So we're going to keep pushing for that. So again, Joe Biden has promised that he won't do Medicare for all. And he maybe will do a public option that allows people to buy in. Well, access to healthcare isn't free healthcare, and it's still going to have a dollar ticket on it. And so I think, yes, let's keep improving things. There's conversation about bringing the Medicare age down to 55. It's a start. It's a stepping stone. I would love to see people just say, let's have Medicare for all until COVID's over. And then maybe we never go back, So I think we've got to shoot for the big apple. I mean, I think if, for those of you who are, congregation leaders, you tell people to love your neighbor. We all need full universal health care. I just think it's the same thing. That's how I look at it. Did that answer the question?
It does. Another question that just came in is, how do we encourage young people to enter healthcare professions, especially if they're people who are in marginalized groups? Cost is one of the big things keeping them out. Some say a cultural division is as well. Chaplain Hatchett, you're nodding your head.
I'm just thinking, I was thinking about that because it's really, if we think about the relationships generationally, there's so many things that I'll say this, when we say current generation, that's everybody that's in the generation that's alive today. But mature, sage members of society can bring those young people in and help encourage them. The other thing is, I think right now, I just got something in the email today at work about an internship that's being looked at and developed at Kent State University to help young people begin to move into community health. These are the kinds of things, if internships and throughout, let's say, parachurch organizations, social agencies, service agencies began to pull the next generation in and help them and showed them the way and taught them the heart of compassion for the community and the neighbors, then they would learn those skills that come alongside that are just as vitally important than the passion with the technical education. The other thing I want to bring to everybody's attention, I don't know how much you follow international, what's been going on during COVID. While we have gotten stimulus checks of $1,400 a few times, etc., other nations have been giving their full salaries, 50%, 2/3 of the salary. Could you imagine if right now, every month, there are some nations that are giving $5,000 stimulus checks a month during COVID, 7,800, on the low side, 2,000. These young people and people in this generation they literally are building wealth during COVID. They are setting up businesses and going to school and retooling while we are picking. It's a whole different thing but in our country, multi-billionaires. Look at what Amazon has made during COVID. So I think our priorities need to change.
Can I say something about the young people? That I think is very important for us to understand. We cannot wait until ninth grade in order for us to high school, in order for us to start talking to young people about careers in science and tech and hospitals. They have to start at elementary school. They have to start. As a matter of fact, they have to start in kindergarten. So we have to start grooming them in order for them to have a thought about these careers in health. Because if we start off early, that would mean they know the technology, they know the terminology, they know all of those things, so it won't seem like foreign as they're matriculating through their high school years. Remember, we're only graduating 33% of our African American students out of our inner city schools, and so if you're only graduating 33%, what's happening to the rest of the young people? And the rest of the young people are kind of just being left to hang out. And so for us, that is wrong. And so when we look at these numbers, the other thing that we have to look at when we're talking about COVID is we have to look at the other risk factors that go along. I understand that this is a faith thing, but everybody don't go to church. And so because of that, we cannot tell young people who don't go to church, because young people believe in God, but they don't believe in secular religion. So we cannot tell them, oh, well, you need to go to the church in order for you to get the information about COVID, because that's not a place that they go to, because for them, that's not a place that they have felt welcome. And so we have to make sure that we're looking at them in places and spaces that are welcoming and that they trust in order for us to help bring them in, because you can't bring them into something that for them is so foreign. And for us, that is so important to our community and for our communities moving forward. We cannot move forward until we understand that there are a lot of people who experience church hurt. And because of that church hurt, that carries them on through life, and that they pass it to their kids and their grandkids. And so those stories are part of what they know and talk about every single day. And so it is a big thing around who people trust and why they trust them.
You touched on something early on delivering food, but more importantly, delivering connection, delivering the message that you cared early on in the pandemic. I'm also thinking of some of the public health challenges before the pandemic, infant mortality, and some of the programs that were showing the most promise were ones where there were one-on-one connections with people in their homes to let them know they weren't in it by themselves. There's almost this throw up your hands, oh my gosh, the pandemic derailed everything, but including those crucial programs. What can we do? How can those one-on-one connections be reestablished in this age of COVID?
So those programs need to still be going on, but those programs, so the mammograms that's literally stopped during COVID. Mammogram mobiles need to go out into the community. Just like, I don't know, I'll be 54 years old, so I remember mobile libraries growing up. How many people remember the mobile library that would come to the neighborhood and you would go over and look at the books and you could check them out? That needs to come back. So what we need to do is look back in the past and bring those ideas to the present, because right now COVID isn't going anywhere. And so because of that, we know that we have so many people that are fearful. Do you understand? Fearful of leaving their homes? Like I am 65 days out of COVID. So 63 days ago, I almost died. I took an experimental drug in order for me to live. My whole family was impacted because somebody showed up at my grandmother's house from out of town and gave it to my 90-year-old grandmother. My 90-year-old grandmother lived. My uncle lived. All of us have all other kinds of health problems as a direct result of COVID. My one uncle has to have his arm amputated tomorrow because of COVID. So, we have to understand that we are never, our community is so bruised. Do you understand that African Americans were 2.9%, 2.9 times more likely to have COVID than anyone else, and about 1.9 times more likely to die. And so I've lost 35 classmates that graduated in 1986. 35 classmates to COVID. 35. That's not what the story is. Do you understand that everybody has a story? They all have these nuances around how COVID has impacted their lives and will impact their lives into the future. So COVID doesn't stop now. This is our beginning to figure out how do we get through this and help people who are traumatized to live.
One of the things that I've noticed, I think those are great points, because I think it's easy when people don't have direct impact to look past. One of the things I've noticed in the African American and minority communities and immigrant communities particularly as well, sometimes people don't always have the support systems and the support structures around them. And so at our Health Equity Center at SUMA, one of the things we have are teams of community health workers that really roll up their sleeves and help relationally help patients get the food. Right now, there's all kind of assistance for housing during COVID. Get the insurance. I mean, if people don't have insurance, we have to help them get on insurance. We have to help them have food delivered to their homes. Take supplies, medical supplies, masks. Take diapers to their homes. All these things are going on. And COVID has caused creativity. I mean, we've been doing things the same way for a long time. We had to learn to relate online. I mean, some people, I came out of IT as well. So I was used to the virtual, but a lot of people had to learn this as the first way to relate. So it's caused us to shift a little bit in terms of how we deliver and how we connect. But nevertheless, I think we have to find those agencies that are willing. See, this is where passion and helping people we lead with that sometimes more than fear now. Because how do you help people? I mean, how do first responders help people? How do doctors and nurses help? How do medical people help people if they're not willing to lay down their lives? We've kind of moved away from that.
Well,
As a
there's a lot of
society,
people laying down their lives in healthcare right now.
The people that have had us to live are these truck drivers, delivery people, the grocers, first line workers, medical. Hey, it's flipped. And these are the people that are being starved out, even in salary, in a lot of cases. But they've been the most critical during this pandemic.
So always a question that comes up in these forums and in any dealings I've had with the Interfaith Coalition is, what can we do? How do we know where to turn? I'm energized tonight. I want to make a difference tomorrow. Help me.
I want to say support organizations that are boots on the ground doing the work in the community. Like the Northeast Ohio Black Health Coalition. I saw someone said something about birthing beautiful communities. Someone else talked about something around, what about mental health support? One of the things that my organization did, because I have a behavioral health and addiction specialist on my team, is started African American support groups for people who have experienced loss, they've experienced COVID, or they're long haulers, because there's more people that look like me that are long haulers. Like every single day at noon, I am so cold that I feel like I'm sitting in an icebox. I lost my hair by the chunks, like whole, like handfuls of hair every day. And people are like, well, your hair looks good. But if I raised it up, you would see that are lost so much. And so for people who are like just trying to get through, you know, remember that everybody is not eligible for the vaccine either. If you have certain chronic conditions, you're not supposed to do it. And if you have people who have had COVID, they have a 90-day waiting period. So, because of that, that's important for us to know, because my 90 days isn't over, and neither is my grandmother's. And then we have people who are going to get the vaccine and think that they are immediately immune, or that there is an immunity. And this is not an immunity. The vaccine doesn't give you immunity. And so they're going out and now they're testing positive before they even get their second vaccination, which is going to throw them off, because now they have to wait in order for them to go and do that again. So we have not tested this. We don't know enough about this whole, the interfacing around the vaccine and having COVID when you're in the middle of vaccinating and all of those other things. This is so new. And that's why, I said, this is not going anywhere anytime soon. Just because of this nature of everybody wanting to open everything up.
So I agree with all that. And, getting involved, I think, is important in whatever way that you can. And it can be small, it can be large. And I always say, it's like giving a hug. You get so much back by volunteering and doing the work. And so the 3 groups that I posted, if you're interested in working for Medicare for All, SPAN Ohio is working for Ohio, and National Nurses United, their website has got all kinds of information about how to get involved nationally, and they are super organized, and they will tell you exactly what to do and who to call and what's going to make a difference. And our Rev Ohio is also doing work for many different things. One of them is Medicare for All. So we did the Road to Justice and Freedom last summer, and for 7 weeks, every Sunday, across Ohio along Route 42 from Cincinnati through Medina up to Cleveland, including outlying places like Toledo, we stood on the streets and we held up signs for Medicare for All to educate people about it. And it was pretty amazing. And it happened right at the time of the George Floyd murder. And so we embraced an additional started talking about, racism as a healthcare crisis and racial health disparities. And we just broadened the issue as we stood on the street corners for 7 weeks. And we probably will restart that again if the person in charge of it finds enough time.
Okay. Well, thank you, Dr. Kranz and the Reverend Pauletta Hatchett and Ms. Yvonka Hall, Director of the Northeast Ohio Black Health Coalition. And also thanks to so many of you for participating and having your own suggestions on what we can do, and for all of us to go out and look for ways we can make a difference. We hope to see you all again at 7 p.m. next Tuesday, when very logically we'll tackle the topic of racial justice, and much of what was said tonight will move us there. If you'd like to support programs like this, please go to the Akron Area Interfaith Council website. It's real simple, akroninterfaith.org. And thanks to everyone who's joined us.